Hi everyone, welcome back to my channel. My name is Yana. If you are new here, welcome. I do create a lot of nursing content and today will be one of the nursing videos for you guys. I also want to mention that I've done my hair and I'm so happy about it. I went today to do a little bit of toning because during summertime when I go to the swimming pool or to the beach or just walk on the sun here in Australia, my hair gets really yellow because I have a lot of highlights in it. And really dry, so I have to tone it every now and then. So I had a little bit of a hair treatment today for myself. I really like it. It's so beautiful. It's gonna wash away in about 3 weeks and all my highlights will stand out again, but they will also give me a pre-mixed like a color or a toning conditioner that I can take with me to Bali because I'm traveling to Bali on 26th of February. And yeah, I was like, I really like it, so I will definitely take that conditioner from them just before I travel and take it with me because I will use a pool a lot there. Anyway guys, in this video I want to talk to you about aged care. So I've got this question quite a few times from different viewers on my channel asking me how to survive aged care work. So I know guys what you're going through. I know what it's like because when I finished the uni, I took about a month or so just to prep my resume and the cover letters and stuff to apply to aged care facilities jobs as a registered nurse because I wanted to start my experience running while I was waiting for my grad program to start. So I was approved for the grad program in a hospital of my choice, but they didn't call me yet as of when to start to sign the contract with them because the grad program goes for a year. Okay, so I thought, okay, while I'm waiting, I know that I was accepted, it was just a matter of time when they're gonna call me. I thought I will go to the aged care facility and just start my experience going so that I could feel a little bit more confident when I go to the hospital, okay, because now, like, I wasn't a student anymore. I was solely and purely working by myself. Like, I could still ask for help from other nurses or from my managers or from the clinical nurse, but it was completely different responsibility. It was completely different feel because now you are responsible for what you're doing and you are pretty much working with alive people, you know. So I was freaking out. I was really freaking out. And on the top of all of that, aged care facility, it's such a fast passing environment. It's so busy. It's like working in McDonald's. Like, I've never worked in McDonald's, but I know what people say when you go to work in McDonald's. It's like crazy busy. Well, aged care is similar to that, okay? And if you are a new grad, if you just graduated and you went to try your luck to get the experience, I know it can be very overwhelming, okay? So in this video, I want to share with you a few advices and tips from my own experience that I hope will help you to overcome your fears and this feeling of being overwhelmed, okay? So the first tip that I want to share with you is, please remember that aged care and any clinical setting when you're working as a nurse is a 24/7 cares, which means you're not a Superman and you're not a Wonder Woman. You only can do what you can physically do. Yes, you can try your best to run a planner, to be organized, you know, to do as much you can do, but do not beat yourself up if some tasks during your shift were not finished. Just because you maybe were distracted because someone had a fall, or maybe you were distracted because you needed to attend a very sick patient, you know, or maybe to do more progress notes or communicate with the family, you know, or maybe spend a little bit more time with the doctor who come on particular days to review the medication and the residents for whatever problems they have, okay? Sometimes the doctors need you to stay with them and give them updates about a particular patient or a particular resident, and that takes time from your daily routine. So please remember that, because that will make you feel a little bit better. I know you as a first new grad, you know, or a new fresh registered nurse or enrolled nurse starting in aged care, you are so eager, you want to show that you can do it, you have this feeling that, oh my gosh, I want to do this, I want to do things right, I want to be able to complete all my tasks because I don't want to be feeling or looking less than the other nurses, you know. But remember, you are a human being in the end of the day, and you can only do what you can do. Of course, you can try your best, and I would encourage you to try your best. But if something has been missed out because you couldn't physically do it because of other tasks, that's okay. There is a new shift coming after you, and you can hand over those tasks that you didn't complete to the next nurse on a shift, and she will complete it or try to complete it. And if not, she will pass it over to the next nurse according to how important and urgent they are. Okay, so that's my first advice to you. Second advice is learn how to prioritize your tasks. Okay, for example, you are doing your medication round, okay, and let's say the morning round is very, very busy. Okay, you have lots of medications, orals, IVs, intramuscular injections, subcuts. You have in aged care probably not IVs, sorry, that's more for the hospital. In aged care you will do a lot of subcuts and intramuscular injections. Then you will have your sugar level checks, BGLs, you will have your insulin administration, you know, and lots of other sorts of and routes of giving medications in the morning. And where I work, I look after 36 residents. We call them residents in aged care because aged care is their home and they reside in there. So we call them residents, not the patients. Anyway, I have 36. In the other aged care where I worked as a carer before, we had 40 per one nurse. And that would be the same whether you're a registered nurse or whether you're enrolled nurse. You still will be looking after this amount of patients, okay? Because aged cares have enrolled nurses and registered nurses working there. My aged care where I work now, we have most of the nurses are registered nurses, and we only left enrolled nurses are the ones who we hired long time ago. They're really great nurses, but the majority they want to have are registered nurses. Okay, so your amount is from 35 to 40 patients or residents to look after. Let's say I give you example about prioritizing your task. Let's say you are doing your medication round, right? And it is very important because everyone needs to have their medications in the morning. Some people won't have a medication for the blood pressure, for the heart rate, you know, and all of that. So they are important to give in the morning. And some medications are good to give with food. And here you have, of course, your phone with you, because as a nurse you need to carry your DAC phone with you all the time, because if the manager or clinical nurse or the family or the doctor, whoever calls you, or a radar or the hospital, if one of your residents at the hospital, they want to call you to update you what's going on or inform you that the patient or the resident is coming back, you always need to have your phone with you. So you're doing your medication and here the phone rings, you know, and you pick up and you find out that it was a family member of one of the residents. They really don't care about the time. They call all the time. They don't care whether it's a morning medication round or whatever. They call whenever they want to call. They call and say, hey, my mom, Betty, let's say, little Betty, you know, how is she going? She had a fall a few days ago, you know, and she wasn't sent to the hospital, which was fine, for example. But I just want to know how my mom is going. And you here need to prioritize, okay? You still want to be professional and polite to a family member of that resident, but you also want to continue your medication round, because here what is more important, to continue the medication round or to give updates to the family member, even if it takes 5 to 10 minutes. For me, it would be to continue my medication round. Not to answer phone is impolite and unprofessional. I always answer my phones. Some nurses do not answer the phones if they are doing medication round. I do. Like if I'm physically giving tablets to someone right now, I might not answer my phone, you know, or I might answer, say, just give a second and put it away. If I'm just looking in a computer and I'm prepping the medication, but I didn't actually open it yet for someone, I can answer, you know. It's just stay safe when you practice, you know. So for me, it would be to continue my medication round. So in this case, I would say to the family member of Betty, I would say, hey, look, I'm in the middle of doing medication round right now. Betty is doing fine, but I can give you more details on what's been happening with her for the past few days since fall if you give me a call after 9 o'clock, because I know that after 9 o'clock, most likely I will be already finished. So I would not say call me after 10 minutes because I will be still doing medication round. I would say call me after 9 o'clock, or even you can say after 10 o'clock if you want to go on a break, you know. And I will give you more details. I'll sit down in front of computer and I will be able to look through the notes and see what's been going on exactly in the past few days. So in this case, you stayed professional. You still gave chance to the person to get what they want, what they were asking, but a little bit later, and you prioritized your task. Okay, I'll give you another example. For example, you are still in the morning rounds of the medication, and this happens bloody every day. You're doing medication, okay, one of the carers coming to you and saying, hey, Betty has a chest pain. Okay, priority, okay? Chest pain is very important. It could be a muscular chest pain because maybe they just puffed up going to toilet, you know, whatever, or it could be cardiac related. Something that might require GT and administration to open up the artery so the blood could flow freely to the heart. You know, so in this case, I would leave what I'm doing. I would leave my trolley. I would maybe take it to the main room just for safety, because a lot of medication there, and you have residents who have dementia, you don't want them to open up any drawers, you know, and overdose them with something in there, or you lock it up, you know. And I would go to the patient, I will grab the obs machine, you know, and my torch to do the neuro obs as well, and I would go to the patient and I will, or the resident, I keep saying patient because I work mostly in a hospital, so I would go to the resident and I would assess them and see what's going on. And if it's really something, maybe it's just anxiety, maybe it's a physical muscle pain, or maybe actual heart, you know. So that would be my priority, you know, and then I would see whether I need to send a resident to the hospital or not. So this is your priorities. Priorities are very important. When you work in aged care, like your manager, I remember when I just started, I was like kind of lost in prioritizing my tasks, because everything seems to me important. Because again, as a new nurse, I wanted to show them that I could do everything. I could complete all my tasks in one go, like in one shift, you know. So to me, everything was important. I couldn't distinguish, apart from if someone dying, like which would be a common sense, like I would go to help the person, but everything else was really important for me, you know what I mean? So I remember my manager, she said to me, look, your most important things that you should try to complete as much as you can is your medication rounds and your dressings. Okay, but again, dressings, just do the complicated first, those ones who maybe had some infection before and the person started a short course of antibiotics on it, so you want to attend those ones first just to see how it's going, you know. And the dressing probably will be leaking and a little bit smelly because the infection was there, and that's why the person is on antibiotics. But if I see, for example, that I have like a lot of dressings, there will be days where you will have fair amount of dressings to change. And there would be days when, if the nurse was busy the day before, she had med calls. By med calls in aged care, I mean someone had a full emergency call, you know what I mean? If she had that, if the doctor came and took more of her time than she would normally give, you know, on her normal planner of her day, you know, so she couldn't complete all her dressings, and the shift and the nurse on a PM shift maybe couldn't do it as well for whatever reason, so those dressings would roll over to the next day, which would be your day. So today you would have your dressings for today plus what's been rolled over from tomorrow, from yesterday. So you will have quite a lot of dressings. There are days like this, okay? There are days like this because it's aged care, anything can happen, okay? So prioritize your dressings. Just quickly have a look what you have there. Do most complex ones first, and if any easy ones like a small skin tears, or if someone has like a wound that's been already healing, not even dressed, but you just for the purpose of monitoring, you just need to go and take a photo and maybe, you know, like archive the whole thing because it's been already healed, you can leave those ones for later, okay? If during the dressings, again, someone had a fall or the doctor came and wants to give you an update about medication change or something, you can leave that and you can go with the doctor. He will tell you that, okay, I changed the dose on risperidone for someone, for example, this is the new dose and now we are doing it only once a day or twice a day, whatever, you know, so you can spend a little bit of time with doctor. And if you couldn't go back again to do the dressings, you know, the amount that has been left, you can hand it over to the afternoon shift, no problem again there. Because remember, you have your morning medication round, then you have your 12 o'clock medication round, and then you have your 2 o'clock medication round, and then at 2:45 or 3 o'clock you clock off. Okay, when you do your dressings, it's not just going to the resident and changing the whole dressing, taking picture and stuff. It's also when you finish changing all the dressings that you've done, you need to go back to the computer and you have to upload the photos that you took of each wound. You have to write in a wound management plan how the wound looks like, if there is any discharge going on, what you've done to it exactly, you know, and just update the whole thing. And for each and every wound, there is a wound management plan on a system that you have to update with the photos and information of what you've done. I'm looking so light in this video now. I don't know, but my cameras pick it up so light. Yeah, so even after you've done all the wounds, like it takes another half an hour to maybe 40 minutes to put all the information on a computer. And then you also have your 12 o'clock medication round that is coming, which you need to start an hour earlier, so at 11 o'clock. So like if you look at it, in HK you have task after task, task after task. It's like a routine. If you fall out of that routine, there is a chance that you won't complete something, which is fine. This is what I'm trying to tell you. Like when you prioritize your tasks, or when you realize that HK and clinical field in general is 24/7, it's okay. It's okay to hand over something to your afternoon shift, and never feel bad for it. You know, never think that, okay, just because I'm handing over something to someone now, they will think I'm a bad nurse, I'm a lazy nurse, or whatever. I've been bludgeoned the whole shift and I haven't done anything. No, nobody gonna think anything about you like that. Okay, like I don't think like that about other nurses who's handing over to me something that I haven't done. Okay, like I don't, because it's normal. We all can have a hectic day. Okay, my next tip to you is, if you feel like you are overwhelmed, you know, something happened, like for example, if someone had a fall and like had a cut on their head or dislodged their hip, you know, and you saw all of that, someone is bleeding, someone is on anticoagulants, you are there, you have to like apply pressure to the wound, you have to call the 000, you know, like for the ambulance to come, you know, like it's a bit too much. And you just was doing the medication round, you know, someone didn't want to take a tablet, yelled maybe at you because they have dementia, you know, whatever, and now you have someone, you know, had a fall, you know, and you're like, oh my god, oh my god, oh my god, like it's too much, I just want to get out of it. Look, after you assisted your patient, okay, it's okay to go and have 5 minutes break, even if it's not your break time yet. Okay, just make sure that you assisted someone. Okay, that person is fine. Let's say you organize the ambulance to come, you know, the person is safe, the blood is stopped, you know, I mean, like the person is not bleeding, whatever. Just go and have 5 minutes break. Have a glass of water, maybe stand on a balcony, maybe get out of the facility completely. Just let the clinical nurse know, or another nurse, that I'm gonna take 10 minutes or 5 minutes out. I'm just feeling a little bit stressed and overwhelmed. In order for me to continue my further tasks that I need to do throughout the day today, I need to have this break just to breathe. Get out, you know, and breathe. Just do deep breathe exercise, the one that we teach in our patients to do, okay, and just breathe. Have a walk. Most of the HK facilities have a beautiful outdoor area, okay. Just have a walk on your own. You can keep your phone with you if you want, just in case if your manager calls you, you know, just to check on you, how you're going, and then go back. Nobody will stop you from having 5 minutes if you have a meltdown, okay? Not if you're in a hospital, not if you're in aged care. I had my clinical facilitators. I remember I had one of my patients, it was actually my day of assessment, because as a grad, they would come to you, I think, twice a year, as far as I remember. So it was my 7 months post practice as a grad nurse. My clinical facilitator, she needed to assess me the whole day. So what they do, they come to you and stay with you the whole day and just watch you, what you're doing, checking if you are safe, checking if you know what you're doing, and they can be your second check if you're doing any SA or S4 medication administration. Okay, so she was with me that day, and we had one of my patients. He was a very difficult patient. He was refusing all medical interventions. He had very bad edema in his legs and in his abdomen area, so he had a lot of fluids in his body, and he didn't want to take any diuretics to get rid of that fluids, and he didn't want any surgical intervention either. So I don't know why my camera is so light. Hold on, guys. Oh, that's better. So he was like literally dying. Okay, I was looking after him 3 days prior to that day, so he wasn't new to me. Like, I've been already looking after that patient, but for my clinical facilitator, that person was new, and I kind of got used to idea that he might die anytime, but it's his choice to refuse the treatment. You know, he was there literally for pain relief. All what he wanted from us is just to give him analgesia. Okay, so when she was with me that day, I remember it was about 11 o'clock, so we've done our rounds, you know, I needed to do some other cares to that patient and stuff, and then she said to me, Yana, do you mind if I'm going to go for 10 minutes? She said, I just can't process the fact that this person is refusing all the treatment options that we're providing for him, and he's about to die. And he wasn't even palliative yet or anything like that. He was willingly, mentally okay refusing the treatment. And I said to her, yeah, sure, of course. So even facilitators need sometimes a break to process something that's either stressful to them or overwhelming or, I don't know, painful to look at, basically, you know. So don't feel bad if you want that 10 minutes off. And my last tip is to ask for debrief. Okay, I remember, I think it was 3 months or so after practicing in my aged care facility, I was already called back then to start my grad program in a hospital, you know, and I was casual at my aged care because I started as a permanent at aged care, and then once I was called to do my grad program at the hospital as a permanent grad there for the whole year of contract, I changed myself to casual. So I was still going to my aged care as I'm going now to do my shifts. And when I was permanent, I was always locked into same floors. I was on a floor 1 and on a floor 3, okay, but majority of my shifts were on the floor 1, so I knew all the residents there. Like, I knew them well enough, like everything about them, you know. And then once I started to pick up shifts as a casual, they started to send me everywhere. So they sent me to level 4 once. Okay, I knew nobody there. Okay, and they have a lot of dementia residents there, that some of them quite aggressive, and I didn't know their medication and the medication in a trolley, and sometimes some people won't have the Webster packs or, you know, like a raw medication that's supplied by the hospital that you will see, not by the hospital, by the pharmacy, that you will see in majority of the aged cares. But some of them, if someone just came new or someone came from the hospital or someone is on a respite, they would have medication in boxes, you know, and then you have to go not by the system but by the paper chart. And I didn't know anyone there, like I didn't know most of them, like, at all. I remember I took my medication morning round till 10:30. Usually I finish like by 9, you know, I start 7, I finish 9, 8:30, you know, and it took me like till 10:30 to finish the medication round. This is very, very late for me because I didn't go on a break yet. I needed already like half an hour ago to start my wounds changing, you know, and stuff, dressing changing for the wounds. I was so overwhelmed, like I couldn't do it, you know. And then like that day I didn't complete my wounds. Like I think I've done only like 4 or 3 of them, and then I needed to do my 12 o'clock round medication because I had insulins to give and stuff, and then I needed to do the progress notes and stuff, and then I needed to do like 2 o'clock. And I remember by the end of the shift I was still freshly new registered nurse, because it's been only 3 months of me practicing, so I'm still learning, I'm still not 100% confident yet. And I felt so bad that day. I felt so bad. I was first of all stressed because I didn't complete most of my tasks. I felt so bad handing over most of my wounds to the afternoon nurse. So when I was feeling really bad by the end of the shift, I remember just when I was waiting for the nurse to come to replace me for the afternoon shift, I called my clinical nurse and I said to her, look, I had this terrible shift today here because I was sent to the floor that I've never been to, you know, and I am just feeling so bad and feel so useless. I feel like all the progress that I've done during these 3 months of becoming better and confident today was just like went to the floor, basically went to nothing, you know. It just like everything just crashed, you know. All the confidence that I had in me, like that a bit of confidence, it just like all vanished. And she was like, she said to me, come to my office when you do the handover and the medication check, count. She just come down to me, I'll talk to you. Even though it was her time to go home, like she could have just went home and she would just tell me, oh, just send me an email, you know, like, and that would be it. But she said to me, just come down to my office and I'll talk to you like face to face. So I've done that. I went to her, I've talked to her, you know, so we stayed over our time, which was really nice of her, you know, because we all have life, we all have kids, but it was really nice of her, you know, to stay a little bit longer. So she talked to me and she was like, look, it's okay, you know, what happened today doesn't distinguish you as a bad nurse or to be worse than what you were before, you know, like nothing happened, she said. And this is when she said to me, just concentrate always on your medication rounds as much as you can. If you can't do wounds, that's fine. If you can't do progress notes, that's fine. Just make sure that you're giving all your medications as much as you can, okay? She said that's what's important, okay? She said there are bad days, there are good days, okay? She said it's okay. She gave me that good support and made me feel when I was going home that it was okay. It was okay. I'm not a bad nurse, you know. I still have managed to do what I've done today, and that was my best, considering this environment that I was in, that it was unfamiliar area for me. I didn't know the residents. Still yet I did not kill anyone. I remained a safe practitioner that shift on that day, and I've done as much as I could. I saved the day, you know, from my perspective, okay? It could be much worse, but it didn't happen, okay? So she made me feel like it was okay, okay? It was okay. I will be better next time. And you know what? Since then, when I swapped to be casual, I go now to all levels of my aged care facility. We have 4 main levels, and then we have kind of like a ground level, which is a lockup unit, which is like a 5th area. And I go to all areas now, and I know them all. And it's like nearly 380, I think, residents. Like, and I know them all. I know them all. It's like I'm not scared anymore. If I don't know someone, I know that I am doing now as much as I can do, okay? I'm not a Wonder Woman, but I'm a safe practitioner. Safety in the end of the day is the most important for me, you know, and I can only do what I can do. So this is my tips for you guys. This is my advices for you. I know that you're all wonderful nurses, no matter what. Don't let anything on anyone to put you down, okay? Because we all have this process of learning when you're just starting, or even if you've been like a nurse for a year or 2 or even 3. In nursing, it's an always ongoing learning process, okay? You are better, you're becoming better every single day. And if one day it's been a crappy day and everything seems like it's going to happen like an apocalypse and everyone's gonna die and everything, you know, those days happen, okay? This doesn't make you a bad nurse, okay? So remember, 24/7 cares, prioritizing, taking break when you need to, and debriefing. Okay, also I want to say in the end of this video before I finish, remember, when you are pushing yourself out of your comfort zone, this is where and when you learn, you become better, you become more brave, and you learn new skills, only by pushing yourself out of your comfort zone. And I know, like, if you've been a nursing student on your practices, and when the facilitator tell you, okay, it's your time today to practice insertion of the IDC, and you're like, no, I'm scared, I will do it next time. If you're always deferring things to the next time, you will be always scared to do that. You will never do it. And then when the time comes for you to graduate and practice on your own, you will be freaking scared to do it because you never gave a chance to yourself to practice, you know. So that's why I'm saying, always try to do new things, you know. And when you have something scary or overwhelming at your work, this is where you learn to be stress adapted nurse. So you will next time won't be feeling that scared and overwhelmed. You will be like more calmer, you know. Yeah, like everything is crashing around you, but you will be calmer. And you know, and like the more you push yourself out of this comfort zone, the more you practice these things, you know, the more you see things. Like after a few years, you know, it's one of those TikTok videos, if you've seen them on TikToks, you know, when the med call in a hospital rings, you know, the student nurse and the grad nurse are like, yeah, I want to help, I'm running, you know. And the nurse who's been there like already for 5-7 years, she's like calmly walking, yeah, okay, med call, yeah, I'm going there, I'm going to help, but I'm not like, oh my god, like I'm just like, yeah, chilled, you know. They still help and they still do it. Like, it doesn't mean that they don't care. No, they do care, you know, and they get there in time and stuff, but they're calm, you know. They are calm. And when someone sees you calm, it's actually good. It's better than it's like, oh my god, what's happening? Because when someone sees you calm, they feel calm. Your patient will calm when will be calm when you are calm, you know what I mean? So yeah, I hope this video was informative and helpful for you guys. If you have any more questions, feel free to leave them in a section below. In my next video, while I have a little bit of time now, I want to record what skills you can gain from aged care facility by working there as a nurse, because a lot of people have this misconception that only skills valuable ones you learn from hospitals, but nothing in aged care is just a waste of time. I just want to talk to you in my next video that it's not waste of time. I want to tell you from my perspective what you actually learn from aged care work and how you can benefit and what you can bring from this field to the hospital if you want to move as a registered nurse to the clinical setting place to work. So stay tuned to that. I will leave the link to that video under this one, hopefully, and so you could guys find it and watch it. Till then, I'll see you in my next ones. Bye.